The Health Foundation and King's Fund have come together to build the argument that the NHS needs a dedicated transformation fund to oversee and fundamentally be accountable for large-scale change within the NHS. We've known for quite a while that there's a need to adapt the way that we deliver services for the population, to move away from the predominantly in-hospital services to provide more out of hospital. But while we've had common consensus on the need for this for quite a long time, we haven't actually driven that agenda forward as quickly as we'd like to. We think one of the problems, the barriers that's in place stopping that, is that we have quite a lot of well-intentioned, disparate, different funds all trying to do the same sort of thing. Whereas if we had one single function that was accountable for delivering the change, they'd be able to learn from what you need, from current transformations, to really understand what you need, and then have a clear objective to pushing change out throughout the NHS. We've looked at what the first few functions of the Transformation Fund would need to be. Long term, we see it being a fundamental part of the NHS's DNA, but in the short term, we think we need an efficiency strand for the next 5 years that has a clear objective for working with staff on how to deliver a greater rate of efficiency growth over the next 5 years, which is crucial if we're going to achieve financial stability by the end of this Parliament. Equally, to make progress on understanding the best way in which services should be delivered, we need an investment in what we're calling a development strand that would work in 2 waves, each covering around 10% of the population, to get a really good understanding of what these new models of care would need to look like. Following on from that, we think there'd need to be a second phase that took the learnings from that development strand and rolled that out across the NHS as a whole. Whilst we've looked at the first 2 phases and those 3 strands, it's crucial to understand that we don't think that would be the end of the story. The Transformation Fund would need to become a fundamental part of the NHS to ensure that we're constantly identifying and implementing changes that are required to ensure that the NHS can continue to deliver a high quality service in a sustainable way in the years to come.